Now let's dive deeper into the coronavirus pandemic and all the latest updates coming out of individual states like Florida and Arizona that show signs as the next coronavirus epicenters. Meanwhile, states like California, where I'm in, have reignited this discussion around masks and the political debate surrounding it. Let's bring in Dr. Brian Garibaldi, Johns Hopkins Biocontainment Unit Medical Director. Dr. Garibaldi, thanks so much for joining us on the program today. As we parse through all of this data, we have 2.2 million confirmed cases here in the US. They account for about 1 in every 4 cases worldwide. How are you anticipating, there must be a lot of shaking of the head going on as we see kind of reopen states as the numbers are proving that maybe we shouldn't be reopening?
Well, I think what we've learned over the last couple of weeks is that this virus is not going to take the summer off. I think as we've opened in certain states, we've expected an increase in numbers of cases as people are moving about more. And obviously, even if a state is open, individuals still have the ability to impact their own risk and to impact the likelihood of transmitting to others by still engaging in social distancing where possible and by wearing a mask. I think early on in the outbreak, there wasn't clear data that masks would stop transmission, but I think there's emerging evidence, both from modeling and from some case series, that suggest that masks do, in fact, reduce the spread of transmission. And so I think where possible, people, particularly in indoor spaces, should be wearing masks if they're not able to socially distance. I think there's been a lot of speculation that, well, maybe some numbers are going up because states are testing more frequently, and that's why we're seeing an increase in the number of cases. Well, if that were the case, then we wouldn't expect to see an increase in hospitalizations, which we are seeing in the states where the number of cases are rising. So these are real numbers. Coronavirus is still spreading in the community, and we are one of the largest countries in the world in terms of continued transmission.
On that mask point, they have somehow become a political flashpoint, right? Where some governors are saying, hey, we're actually going to start lawsuits against individual companies that mandate it before entering buildings. How is this sort of, as you rightfully point out, it's a very simple task, and initially perhaps there was some doubt around its efficacy, but it's been clearly stated, right, from organizations like the CDC that show that it could be effective and it's the best way to go. How do you anticipate, if people don't actually adhere to these new sort of regimens and restrictions, that it could continue to escalate? Can we expect more than 200,000 deaths by this fall?
Well, I think we're really concerned about that, right? I think the projections continue to be a moving target, and obviously, we're a quarter of the cases in the world, but we're also a quarter of the deaths. And that number will, if we have more cases, we're going to have more deaths. That's unavoidable. And I think we've talked before about trying to balance, the harms from, the economic instability that the virus has caused. But wearing a mask is not the same thing as forcing a business to close or having to, have a stay-at-home order. So I would hope people would look at the data and recognize that they can actually make an individual difference and a difference in their communities if they're smart about their activities and if they're willing to wear a mask, even if it's not something that's required in the activities that they're doing.
And of course, today is Juneteenth, and there are some protests happening around the country, but those are in open spaces. Meanwhile, in Tulsa, Oklahoma, where President Trump plans to hold a campaign rally tomorrow in an enclosed space in a bank center, there was a lot of dispute about whether this should happen. There have been lawsuits filed against the center itself, but ultimately Tulsa's mayor said, there are risks involved. We expect 100,000 people in the vicinity of the center, and the show must go on, and masks are not required. What is your take on this event that will happen tomorrow? Can we expect, in a couple weeks to see a huge surge in cases in Tulsa County, which already had a record in terms of number of cases today?
Yeah, I'm really worried. I think Oklahoma itself is still on the rise, even though the number of positive tests is still below that 5% threshold where we think that we want most states to be. It's close to that 5% threshold, and it rises every day. And yesterday they had twice as many new cases as they did a week before on the daily numbers. So I think this is the exact type of event that if you were able to avoid, you probably should try to avoid, because having people in an enclosed space where there's going to be, probably people talking to each other, shouting, yelling, we know that those are risk factors for transmitting the virus. And, there's no way that you're going to be able to prevent asymptomatic individuals who have this infection from getting into that arena. And a lot of people are going to be at risk from it. And I hope that we're wrong and that there aren't a cluster of cases that come out of this event. But I'd be very worried that in 2 to 3 weeks, we're going to see a clear clustering of cases that come out of this type of event.
And very realistically, I imagine that there will not be too many mask wearers in the arena if they're trying to shout and engage with other people, as you mentioned. And then on the vaccine front, when we look at companies like Moderna, AstraZeneca, there's a new note out from the brokerage firm Jefferies that says we could potentially have a vaccine approved by the end of this year using an Emergency Authorization Act. What is your timeline as you have a good pulse of the health industry? Do you feel as though even with all this fast tracking, that could be possible?
I think it's possible. I think that most people involved in the development and also the policy around these vaccines have made it clear that safety still has to be the number one priority. And so while there might be a vaccine that has some data saying that it's effective at preventing the disease, I think what we need to have before we can move forward with mass vaccinations is the safety data. And so I think end of this year is a pretty aggressive timeline to have enough patients to get this vaccine to know if it's safe. But if we're able to do that, if the companies and the trials that are being run are able to do that, then it's possible